A set of tests for the group of ligaments, the sacrotuberous, the anterior sacroiliac, the posterior sacroiliac and the interosseous sacroiliac are the spring tests and the rocking tests. So I'm going to do all of them because they're quite similar. I'm going to do them together. So we do it on two sets of axes. We do it on the left and right transverse axes and the left diagonal axes and the right diagonal axes. The spring test, we're just pushing down to see if there's any resistance, and then the rocking, we're seeing whether we've actually got some movement in the sacrum. So the 2 points that I need to locate are the base of the sacrum. So if we find our PSISs, which are there, and then we just go inside that, and there's the base of our sacrum. So that's where we're looking at, first of all, the transverse axes. So there's where we put the thumb, i.e. just on the base of the sacrum. We then use our thenar eminence of the other hand. If we find the coccyx and just come outside of that, there's our inferior lateral angle on the right hand side. And we put our thenar eminence on that. And for the spring, really our right thumb at the moment is just a feeling thumb, and we're going to push down with the thenar eminence onto the ILA on the right hand side there, just a little spring. And what we want to see is, can I feel with my thumb that sacrum moving, or is there resistance? So it is just literally just a little spring there like that. We then move across onto the left hand side, find the left ILA, and we do the exact same thing with that. So we just push down. For the rocking of the transverse axes, all we do is we're in exactly the same position. So we've got one thumb on the sacral base, the thenar eminence on the ILA, and instead of springing down, what we do this time is we rock it backwards and forwards to see how much movement there is. And this can actually be used as a treatment as well, and you get that nice rock going backwards and forwards. So we would just do that on one side, and then we go across and we do it on the other side to see whether we've got that rock as the test. So that's the transverse axes. For the oblique axes, then what we're doing is we've got one thumb on the sacral base, and on this side we're going on the right diagonal axis. So I've got the thumb on the right sacral base, and then I'm going to put my thenar eminence on the left ILA now, so we're onto the angle. And again, for the spring test, all we're doing is just pushing down with my left thenar eminence on the ILA there to see whether or not that moves up or not on my thumb, to see what resistance there is. And for the rocking on that same angle, all I'd be doing is rocking it backwards and forwards. And then for the spring test, for the left diagonal axis, I move across and I put my thumb on the left sacral base, my thenar eminence on the right ILA. For the spring, I'm just pushing down towards the couch, i.e. pushing the sacrum anteriorly there. And when we're rocking it, I am just pushing with my thumb and that thenar eminence. So that is the spring, where you're pushing down towards the couch, and the rocking, where you just rock. And you do it on the transverse axes, and you do it on the two oblique axes.